Today's learning module is on the HPO axis and menstrual cycle basics, two of the complex but necessary structures and processes to understand if you work in an endocrine office or an infertility center. My name is Monica Moore. I'm a nurse practitioner with 20 years of infertility and reproductive endocrinology experience, and I hope that by giving you some knowledge of these today and using my experience that you'll be confident in relating to patients and answering patients' questions, both by using this module and future modules put out by Fertile Health. So let's start with Part 1, the HPO axis. As discussed, it's coordinated by a system of feedback loops. So as one level increases, here I'll show you as estrogen increases, another one will decrease or get cut off. And you'll see that when we talk specifically about each different hormone. The HPO axis working properly is dependent upon the interaction of a properly functioning hypothalamus, again that's depicted by these stars, pituitary gland, and ovaries. So if any of these don't work, the HPO axis won't work properly. And this is important to know when we start to discuss medications, particularly the oral medications for fertility, that rely on this system to work. So the H in HPO axis is the hypothalamus. The hypothalamus is sort of the boss of the cycle. It drives the cycle. It tells everybody else what to do. It secretes a hormone called GnRH, or gonadotropin-releasing hormone, in a pulsatile manner every 60 to 120 minutes. Is it important to remember the 60 to 120 minutes? Not necessarily, but what is important to remember is the fact that it is pulsatile. So if anything changes the amplitude, which is the height of the pulse, or the frequency, which is how long it is between pulses, you're going to change the function of GnRH and potentially change the cycle regularity of the patient. That's another way that the infertility medications work, and another reason why it's so important to have a very good working knowledge of the HPO axis. The other thing about the hypothalamus is it's very important in other bodily functions, particularly in maintaining your metabolism, maintaining your temperature. It secretes other hormones called TRH, thyrotropin-releasing hormone, and CRH, corticotropin-releasing hormone. These hormones are usually secreted in order to maintain body homeostasis. They're incredibly important for the survival of the body and for the fight or flight response. And as you'll see when we discuss the GnRH a little bit more in detail, secretion of these hormones will cut off the secretion of GnRH because the body needs to maintain its blood pressure, needs to be able to metabolize electrolytes more than it needs to reproduce when it perceives that it's under stress. And so here's a depiction of when corticotropin-releasing hormone is released from the adrenal glands in response to stress. It shuts off the release of GnRH. Therefore, when the body perceives stress, which in some patients could be that there actually is stress, it could be that there's a chronic illness, it could be that they're malnourished, that they have an eating disorder and the body perceives that it is in starvation mode, that it releases this CRH, or corticotropin-releasing hormone, and then GnRH is no longer released. As a result of GnRH not being released, the pituitary is never stimulated and people don't get regular menstrual cycles. The P in the HPO Basics is the anterior pituitary. So there's two lobes of the pituitary gland. The posterior pituitary here is important for secreting certain hormones, but not the hormones that we're going to be talking about as much today. So mostly what we're focusing on is the anterior pituitary. The hypothalamus acts on the anterior pituitary gland to secrete these hormones that are overall called gonadotropins, and you're going to hear that name a lot when you work in the fertility field. And what we mean by gonadotropins are follicle-stimulating hormone, FSH, or luteinizing hormone, LH. The anterior pituitary also secretes hormones called TSH, thyroid-stimulating hormone, and PRL, or prolactin, in response. And two of these hormones that we are going to talk about at the end of the talk, if they are overly or underly secreted, can also affect pituitary gland production of the gonadotropins and affect menstrual cycle regularity. So here's a depiction then of prolactin being overly secreted, and then the FSH and LH that would normally be secreted from the anterior pituitary gland is then cut off. This is an example of what we call negative feedback, when you have an increase in one level and it shuts down the other levels. So the anterior pituitary acts then on the ovary, which is here circled in red, to secrete two important hormones probably that you've heard of before and will be hearing about a lot, called estradiol and progesterone. And we're going to be talking about them at great length during this talk. So estrogen is mostly produced by a developing or maturing follicle, shown as this white circle here in the ovary. Progesterone is mostly produced by what's left over after a follicle ovulates, something called the corpus luteum. The corpus luteum secretes progesterone. Progesterone also feeds back to the hypothalamus and pituitary and tells it to increase or decrease certain hormones. So in order to get a better understanding of how all these hormones work separately, now that we've reviewed them a little bit, let's look at this as an interactive slide. Again, just to orient you to this, we have the hypothalamus, the anterior pituitary, and the ovary. And what normally happens is the hypothalamus, as we discussed, secretes a hormone called GnRH. GnRH is secreted in a pulsatile manner. It's not really shown in this picture, but secreted off and on, and acts on the anterior pituitary to secrete two gonadotropins. So the first one is FSH, follicle stimulating hormone. And it does basically what it says that it does. So it starts growing follicles in the ovary. And just to review, a follicle in the ovary is basically a cyst that holds an egg. Eggs are microscopic, so we can't see them or measure them. But as the egg grows and matures, the follicular fluid grows and matures, and that's what makes the follicle grow. So we use follicles and oocytes and eggs interchangeably, but there is a little bit of a subtle difference. So FSH starts to increase the growth of the follicles, and as the follicles grow and mature, they secrete a hormone called estrogen. Estrogen will feed back to the hypothalamus and pituitary and tell it to stop secreting GnRH and stop secreting FSH because it doesn't need it anymore. There's no need to keep secreting follicle-stimulating hormone when you already have a follicle made. The estrogen reaches a certain level for a certain period of time, and then it causes this feedback system to be what's called a positive feedback system, where the increase in the hormones causes an increase in another hormone. In this case, the increased estrogen causes an LH surge. The LH then causes ovulation to occur, here shown by the egg leaving the follicle, or follicle rupture. And what's left after that, hopefully that egg will go into the fallopian tube to be fertilized by sperm. What's left then of the follicle is this structure called the corpus luteum. As we mentioned before, the corpus luteum produces a hormone called progesterone that feeds back to the hypothalamus and pituitary and tells it basically, we've already ovulated. We don't need you to make LH anymore. The corpus luteum is a structure that has a finite lifespan, so it basically only lives for 14 days. If after 14 days a pregnancy doesn't take place, HCG, which is the pregnancy hormone, is not either given to a person or produced because somebody's pregnant, then the corpus luteum will start to what's called degenerate or regress. As it does, the production of estrogen decreases and the production of progesterone decreases. Then what happens is the GnRH starts to work all over again because there's no suppression anymore. The estrogen and progesterone levels have gotten so low that the GnRH can now be secreted again to then secrete FSH, and the whole cycle begins again.